My name is Darren Chalmay. I live in Ballyfermot and I went to public school at Salta for 6 years in Palmerstown.
My name is Ife and I actually grew up in Cabra, and I went to a school in Cabra called St. Dominic's College. That was my secondary school, and then my primary school was Mary Hope of Christians on the Navan Road. I'm currently a third year pharmacy student in Trinity College, Dublin.
Hi everyone, I'm Salwa. I'm a third year dental student here in Trinity, and I'm so excited to be making this video. Here I am in DDUH, the one and only. This is the clinic behind me. This is where all the magic happens. So you got the chair, you got everything going on. This is where the patients have their procedures that are given by us and obviously supervised by dentists. I decided to come to this college because I saw so much opportunity. I really wanted to do something to do with healthcare, something to do with patients. I just loved that kind of environment, and I thought that's where I see myself in the next 10 years. So I decided to come to Trinity and do dentistry.
I decided I wanted to go to Trinity because I wanted to prove that anyone can go to university and you don't need to be this kind of stereotype candidate. And as a student from a disadvantaged area, it was hard to kind of overcome the countless challenges that we face, like being told that you're not smart enough or wealthy enough to go to university, let alone Trinity College. But in fact, you can do anything that you put your mind to, like, really.
I decided I wanted to go to university just to sort of give myself options. Also because I wasn't really sure what I wanted to do, with my life. So that's actually why I applied for the Trinity Access program. So I applied for the Trinity Access program and I did the foundation year for a year. And I decided to do pharmacy because I really loved chemistry in secondary school. I really enjoyed it during the foundation year as well. So that's why I did pharmacy. I think my favorite thing about college is just getting to meet so many different kinds of people. I don't think I would have ever had the opportunity to meet them.
There's like a huge window right in front of me, and I can just see the beautiful campus in front of me. That's one of the amazing things about college, is the campus. I love Trinity campus. So in college, of course, you're gonna have to face some barriers. That's a given. I think with everything in life, there comes challenges and barriers that you're gonna have to overcome. With the support of Trinity Access Program and college services, they truly will be there for you. Whether that's financially, whether that's educationally, whether that's emotionally, I think Trinity Access Program truly is there for their students. It's there for you, to help you with your undergrad, to help you cope with all these challenges and difficulties, so you're not alone. So if you feel like you come from a background that doesn't support or doesn't give you the basic needs in order to be successful in college, don't worry, like Trinity Access Program is there to help you. So that's not something that should stop you from coming to college. Because you'll always find help here, no matter what.
I'm now studying a Bachelor of Science in General Nursing and I'm in my second year of the 4-year degree. I was always kind of good at science in school, but I did think that I needed chemistry for the Leaving Cert to get into my course, and it wasn't really my strong point. However, after speaking with students at open days and people coming into the school for College Awareness Week, I soon realised that I only needed one science subject, so I decided to pick biology because that was my favourite subject, and I'm quite glad that I did pick biology because it's helped me a lot in nursing. We do a lot of human biology, learning about the different systems like the digestive system, and it all kind of worked hand in hand for me. But we do learn a bit about chemistry as well, so we learn about medication and how that affects the body, like what effects it has, how it can react to other medications that somebody might be on. But we learn about psychology and how our emotions are affected, like when people are in hospital, how to help them with their emotional needs as well as their physical needs. We learn how to visually assess if someone is getting sicker or becomes really unwell while they're in hospital, and we also learn how to be compassionate in end-of-life situations. So my sister passed away 8 years ago, and kind of seeing how the nurses looked after her in the intensive care unit made me really think about wanting to pursue a career in nursing, and to be able to help others in that situation. Nursing also has quite a large practical side, so where you're paired with a qualified nurse for a minimum of kind of 4 weeks in first year, and you do placements then every year after that. So that can be you're participating in all kind of aspects of nursing care, from checking someone's blood pressure and their temperature to giving out medication when you're in 4th year, and updating doctors on how the patient's condition is, if they're getting worse, if they're getting better, if they can go home, and kind of just updating them on what's going on a day-to-day basis.
The subjects I did for my Leaving Cert to study pharmacy, I think chemistry and maths and biology are really important. And like I mentioned earlier, I really enjoyed chemistry growing up. My family really helped me coming up to deciding what I wanted to do. And also the Trinity Access program also really helped as well. There was a lot of support from the foundation year. There was a lot of support from the staff. And I would really recommend applying for the foundation course. Pharmacy is a very challenging course. So there are a lot of hours and there are a lot of lectures. But what I really love about it is I really love my classmates, and everybody helps everyone and everybody helps each other.
I just always love learning the reason behind why we do things. I think the physiology of the body is just so mind-boggling, to understand the mechanisms behind why your body does a certain thing. It's just so interesting. You have to do chemistry and you have to do biology. Any sciences really, any 2 sciences, you need 2 sciences in order to study dentistry. A higher level maths, of course, that's a given. So I decided to do dentistry because I really wanted to do something in healthcare, and I didn't want to do medicine because I just felt like that's not for me. I didn't see myself as a doctor anytime soon. It's a 5-year degree. In the end, you become a dentist. Fully practicing dentist. You are a professional. It opens a lot of doors for you, I think, in my opinion. But you can become whatever you want straight after this undergrad. You can go and do a different degree. You can do graduate entry into whatever degree you want to do. The hours are a bit longer than any other course. I have clinics. I also have labs. Labs is where you get to practice on dolls, which is really fun. So here's my bag full of teeth. So they'd be like attached to a doll basically, and you would drill. You can see here I did, this would be called a class 2. I don't know if you can see it. But yeah, it's very fun. I love labs. Labs are just an amalgam, which we don't really do anymore in real patients. But I think it's a lot of fun. I think dentistry, if you're a very hands-on type of person, if you care about anything to do with healthcare, oral care, if you see yourself gravitating towards patient care, I think it's great. It's very personal. It's very one-to-one with the patient. We're the only course in college that gets to interact one-to-one with a patient in 2nd year. No other course does that, not even medicine. I think it's very patient-oriented. Obviously, my favorite part in college was the friendships that I've made. Lifelong friends forever. I'm so grateful for my friends that I've made here.
So I believe that nursing is actually kind of like a passport. So I've had a lot of people ask me like, oh, where can you go after you qualify? It kind of just opens the world. Everywhere accepts a nursing degree, everywhere has nurses, and it's something that you really can travel with if that's what you're into. There's also a lot of kind of options for postgraduate courses after you graduate in your nursing degree. You can go on to do a medicine degree and become a doctor, or you can do a postgraduate course in care of the elderly or children's nursing, and you can even become a midwife after your degree. I myself would like to go and become a doctor. I'd like to study medicine and to kind of further my medical education, and I'd also like to move to Canada and kind of travel for a while and just see where that takes me.
What I would like to do when I graduate is, I'm not too sure for now. I think I would like to work as a pharmacist for at least a year or 2. But I do look forward to going into the profession. But as for now, I'm not too sure of exactly what aspect of the profession I would like to be a part of?
I would really love to work for a few years, see where my head is at, see what I like to do for the rest of my life. I'm not really sure just yet what I want to do, and that's okay.
My advice to anyone considering a degree in general nursing would be to just go with your gut and kind of trust that you will provide people with the highest quality of care possible, because we all know that hospital can be a lonely time and a lonely place for some people. So never give up on yourself and your abilities, because you are the only person that has the power to hold yourself back. And I believe that if you keep striving and you don't listen to all these stereotypes and people putting you down, you really can get to where you want to be.
My advice for anyone considering pharmacy is, be prepared for the work. But I will say that you do get a lot of support from the staff, and if you ever need help, don't be afraid to ask for help. They will help you.
So my advice for people considering dentistry is to study really, really hard. Work your butt off. I think it's important to also have extracurricular activities, whether that's the gym or whether that's playing football or soccer just with your friends. It's so important to just have some kind of breather, to be able to just breathe and just let go of all that anxiety that's built up, because it will definitely help you throughout dentistry to have something to be able to do as a hobby.
My name is Darren Sean May.
My name is Ife.
My name is Selwa.
I'm a second year general nursing student.
I am a dentistry student.
I am a pharmacy student in Trinity College Dublin, and I am proud to support College Awareness Week.
Agus tá brodil as tachu le seachtain fascta cláiste.
College Awareness Week.